Alcohol abuse and alcohol dependency. Alcohol use disorder, which includes a level that's sometimes called alcoholism, is a pattern of alcohol use that involves problems controlling your drinking, being preoccupied with alcohol, continuing to use alcohol even when it causes problems, having to drink more to get the same effect, or having withdrawal symptoms when you rapidly decrease or stop drinking. Symptoms: being unable to limit the amount of alcohol you drink, wanting to cut down on how much you drink or making unsuccessful attempts to do so, spending a lot of time drinking, getting alcohol, or recovering from alcohol use, feeling a strong craving or urge to drink alcohol, failing to fulfill major obligations at work, school, or home due to repeated alcohol use, continuing to drink alcohol even though you know it's causing physical, social, and interpersonal problems, giving up or reducing social and work activities and hobbies, using alcohol in situations where it's not safe, such as when driving or swimming, developing a tolerance to alcohol so you need more to feel its effect or you have a reduced effect from the same amount, experiencing withdrawal symptoms such as nausea, sweating, and shaking when you don't drink or drinking to avoid these problems. Alcohol use disorder can include periods of alcohol intoxication and symptoms of withdrawal. Alcohol intoxication. Alcohol intoxication results as the amount of alcohol in your bloodstream increases. The higher the blood alcohol concentration is, the more impaired you become. Alcohol intoxication causes behavior problems and mental changes. These may include inappropriate behavior, unstable moods, impaired judgment, slurred speech, impaired attention or memory, and poor coordination. You can also have periods called blackouts where you don't remember events. Very high blood alcohol levels can lead to coma or even death. Alcohol withdrawal. Alcohol withdrawal can occur when alcohol has been heavy and prolonged and is then stopped or greatly reduced. It can occur within several hours or 4 or 5 days later. Signs and symptoms include sweating, rapid heartbeat, hand tremors, problems sleeping, nausea and vomiting, hallucinations, restlessness and agitation, anxiety, and occasionally seizures. Symptoms can be severe enough to impair your ability to function at work or in social settings. What is considered one drink? The National Institute on Alcohol Abuse and Alcoholism defines one standard drink as any one of these: 12 ounces of regular beer, about 5% alcohol, 8 to 9 ounces of malt liquor, about 7% alcohol, 5 ounces of unfortified wine, about 12% alcohol, 1.5 ounces of 80 proof hard liquor, about 40% alcohol. If your loved one needs help. Many people with alcohol use disorder hesitate to get treatment because they don't recognize they have a problem. The intervention from loved ones can help some people recognize and accept that they need professional help. If you're concerned about someone who drinks too much, ask a professional experienced in alcohol treatment for advice on how to approach that person. Causes. Genetic, psychological, social, and environmental factors can impact how drinking alcohol affects your body and behavior. Theory suggests that for certain people, drinking has a different and stronger impact that can lead to alcohol use disorder. Steady drinking over time. Drinking too much on a regular basis for an extended period of time or binge drinking on a regular basis can lead to alcohol-related problems or alcohol use disorder. Starting at an early age. People who begin drinking, especially binge drinking, at an early age are at a higher risk of alcohol use disorder. Family history. The risk of alcohol use disorder is higher for people who have a parent or other close relative who has problems with alcohol. This may be influenced by genetic factors. Depression and other mental health problems. It's common for people with a mental health disorders such as anxiety, depression, schizophrenia, or bipolar disorder to have problems with alcohol and other substances. History of trauma. People with a history of emotional or other trauma are at increased risk of alcohol use disorder. Social and cultural factors. Having friends or a close partner who drinks regularly could increase your risk of alcohol use disorder. The glamorous way that drinking is sometimes portrayed in the media also may send the message that it's okay to drink too much. For young people, the influence of parents, peers, and other role models can impact risk. Complications. Too much alcohol affects your speech, muscle coordination, and vital centers of your brain. A heavy drinking binge may even cause a life-threatening coma or death. This is of particular concern when you're taking certain medications that also depress the brain's function. Impact on your safety. Excessive drinking can reduce your judgment skills and lower inhibitions, leading to poor choices in dangerous situations or behaviors. Prevention. Early intervention can prevent alcohol-related problems in teens. If you have a teenager, be alert to signs and symptoms that may indicate a problem with alcohol, which can include loss of interest in activities and hobbies and in personal appearance, red eyes, slurred speech, problems with coordination and memory lapses, difficulties or changes in relationships with friends such as joining a new crowd, declining grades and problems in school, frequent mood changes, and defensive behavior. You can help prevent teenage alcohol use. Set a good example with your own alcohol use. Talk openly with your child, spend quality time together, and become actively involved in your child's life. Let your child know what behavior you expect and what the consequences will be if he or she doesn't follow the rules.